So welcome everybody. Thank you for joining us for today's Security Health Plan Academy. I'd like to introduce our presenter. Today we have with us John Winters. So John is a medical professional with over 30 years of experience. He has served in various roles from the U.S. Navy to his current position as an annual wellness nurse at the Marshfield Clinic Health System, Merrill Center. John has dedicated his life to serving others, and he believes in educating his patients and giving them the information they need to feel comfortable and confident making the best decisions for their quality of life. John's presentation today will explain Medicare's annual wellness visit, why it's important for your health, and how it differs from the annual physical exam. And for those of you with a Security Health Plan, Medicare Advantage plan, your coverage may include additional preventive services beyond what Medicare covers. And I just want to note, everybody on this call today is welcome to submit a question anytime during today's presentation via the chat feature, which is located towards the bottom of your screen. We will try our best to answer every submission, but if for some reason we aren't able to respond, we will provide an answer in our follow-up communication scheduled for later this month. So with that, John, I think I'm going to pass the baton to you. Go ahead.
Great. Thank you so much. Hello, everybody. Again, my name is John. I'm a nurse here at Marshfield Clinic, and I do the annual wellness. And we'd like to speak a little bit about your annual wellness exam, try to clear up some questions and concerns. So through the Marshfield Clinic, again, we're here. We work for you. It's your quality of life that we're really interested in pursuing to make sure that you're getting all that you can as you continue to age and move forward. So through this presentation, we'll try to explain what an annual wellness exam is and why you should have an annual wellness exam. A lot of questions begin to start out with why did this and why did it come about? So many years ago, Medicare found that there was many deficiencies. There were many covered patients that were not being, basic needs and testings were not being met. So they've developed this program. It's evolved into what it is today. Prompted by the Affordable Care Act in 2011, they began paying for and covering a yearly checkup with a physician. Much like when through the working environment, your insurance would have paid for an annual exam, Medicare now pays for that annual wellness visit with a physician, which is designed specifically to address your health risks and encourage evidence-based preventive health care as you continue to age gracefully as adults. So with all of that, what are the different types of annual wellness, and is it required? Medicare, they'll do a couple of different types of titles of exams. Essentially, there's a welcome to Medicare, which is when you're first turning into the Medicare coverage. The physician, it's a baseline exam where they collect all the information, whether you're a new or old patient, to see where you're at that specific time. And then they'll turn into what's called annual wellness exams with the nurse, and those are just checkups from year to year to see how we're doing. Both are available through the Medicare recipients, but they're not required to participate in any of their to maintain any of your Part B coverages at all. They're all preventative and highly recommended, though, to keep in touch with the physician and where you're at health-wise. You absolutely can refuse if you want, but it's, again, recommended that we maintain those. So what's the difference between an annual exam and a physical? The annual exam is a little bit more extensive than what the annual wellness visit is. Both physicals involve an exam by the doctor, which includes blood work and some other tests. And the annual wellness visit would include checking routine measurements as well, such as blood pressures and those kinds of things. It's always a good idea, depending upon your medical situation, you may have multiple visits, which we try to pair up with at least one of those being an annual wellness exam as well throughout the year. they cover things such as like blood sugars and your cholesterols and screening for diabetes. And then some of them are not covered with regards to blood work. So the routine stuff is typically covered. There's some more extensive testing that may not be, but as was alluded to, some of the insurances will cover some of the additional testings that you're required to have. With that, what are the physical exam coverages? So again, the welcome or the initial preventive physical exam. It's basically a review of where you're at to that date. It's covered once a year for the first 12 months. And then after that, they're transferred into annual wellness visits, where again, we develop a pattern of meeting annually to get together to see how you're doing. And then we will do that again once a year. Again, all of these are paid through the Medicare process versus a routine physical exam, where that's an exam performed without relationship to any type of treatment or specific illness symptoms. They're not covered by Medicare. That would be kind of double dipping into the pot, so to speak. But then there would be some out-of-pocket pay with that, just so you realize the differences between the two exams. And again, a lot of the supplemental insurances will cover these, but it's individually your plan on how that's covered. So communication avoids confusion, right? As the healthcare provider recommends getting services more often, we want to make sure that you're understanding those differences. Medicare doesn't cover in this specific visit everything, such as a 6-month follow-up. That's where, again, it's done annually. But just understand there may be some differences in costs, and that's where you can follow up with your security health, if you have that, or your other representatives to see what insurance covers and doesn't specifically. So some other preventive services that are covered, there's a long list of them. And at the end, there'll be a couple of really good links that we can pair you up with to get some of this information. But there are a lot more tests that are covered than what is thought to be. But again, these are some of the pitfalls that members were falling through initially until this program is kind of put together to see where you're at. The initial preventive, again, the welcome to Medicare visit. It's where we meet for the first time while you're on Part B. We kind of gather your whole health history to where you're at that specific time. Some of these, there will be some baseline testing that'll be done. There will be some EKGs to check the heart. There will be some basic lab work and some other screenings. If you're a smoker or if you have family history of like what they call an abdominal aortic aneurysm, some of those kinds of not really routine monitor tests would be taken care of through that visit. Again, it has to be done within the first year of your eligibility as Part B, but then after that, it would fall into the annual wellness portion. And then physical exams by your doctor to figure out what the problem is and what needs to be done. And then we set you up for success with prevention and detection of what you may or may not be realized that you're eligible for, and those kinds of things out in the community as well. So the annual wellness visit and the health risk assessment, every time you come in, there'll be a form of some type that will ask you to complete. The initial welcome to Medicare is going to be, again, a little bit more comprehensive. You'll fill out a little bit more of that form. From year to year, you would fill out this form with anything that's new that you need to share with us with regards to addressing new ailments or new surgeries that we may not be aware of. Those types of things typically would be covered under that assessment form. And we would do that again once a year. So your annual wellness visit, it's an appointment with your primary care provider. and it's used to create or update the personal preventive plan that we would have done on started with the Welcome to Medicare, or if this is your initial because for whatever reason, traveling, those kinds of things, you would have missed out. COVID was a big one. We missed out on a lot of different type of exams that way. But this plan would help prevent illness-based issues with regards to your health. We would talk over some risk factors, safety in the house, as you continue to age, those kinds of things, set up resources that you may not be aware of. To again, become healthier, promote a positive health habits in life. As we continue to age, we want quality of life really to be as best as possible for you. Your annual wellness nurse. So what we would do is I work hand in hand with the providers to make sure all your basic needs are being done. Make sure all the testing is being completed that may get overlooked or forgotten about. We can make sure that you're informed to make those decisions for your quality of life really is what my role is. I would gather that information for the provider so that they can concentrate on you and not that computer, and help answer or initiate some questions to make sure that you're getting all of the concerns addressed while you're at that visit. And then again, there's also community services and resources that you may not be aware of that you can take advantage of to assist you from a day-to-day needs as well. So what to expect? Really, it's pretty standard with regards to most all office visits you would see. We would come out and greet you and get to know you. We'll get you back. We'll do those vitals and weights and those kinds of things, review your medications. And we'll try to address any kind of questions or review topics that we've touched on from the year prior. And then we try to do a little personal summation. We'll give you, I like to call it a receipt for your visit. We've checked all the boxes and made sure all of the testings and things were being done. Make sure that all the other questions and concerns are addressed. Anything that needs to be scheduled, we can make sure that we highlight that for you and get that taken care of so you can make those that fit into your life, those timely appointments so that you're not being overlooked or forgotten as well. So really, it's a great value. It's definitely an entitled visit of healthy living for you to take advantage of. Your overall view of your health is kind of where the parameters are those to where we start to see where you're at and what we can do better for you. We also want to make sure that you're being taken care of and your provider is up to date on where you're at, and so that you can focus to improve your life and your health so that, again, you can quality of life can be as best as possible from the healthcare side of that. And then as far as sharing some informational resources, again, the Center for Medicare and Medicaid Services, the CMS, is really the driver of what we're able to do for you. It's a great educational tool if you're computer savvy or if you have grandchildren, those kinds of things that are available to you. That would be a great website to go through. It's really interactive and gives you an explanation and makes a lot of things clear for you. And that's what I pretty much have for you today. I guess if there's any additional questions or concerns, we can kind of open that up and see what we need to do.
Well, great. Thank you so much, John. That was super helpful. Many of you might have noticed that today we have our friend Jason, who is from customer service. He is going to help us answer some of the benefit related questions that were submitted prior to today's webinar. And we also just received one that I think maybe we'll go through first. And John, do feel free to chime in if you have an answer to some of these questions as well. But the first one that we received: when called to make an appointment for a physical examination, I was questioned if I wanted a wellness exam. I had asked that a physical exam be done. Should I not have asked for a physical exam? My concern is that I may be billed for this. I haven't had any current health issues, but I haven't had anything. I haven't had any current health issues, but I haven't had anything but a wellness exam for several years now. Jason or John, do you have an answer to that?
Yeah, I'll step in here, John. I mean, that's a great question when scheduling the appointment. Now, with our Security Health Plan Medicare Advantage plan, members do have coverage for the physical exam. But some Medicare plans, they don't offer coverage for that exam, and only in the annual wellness exam. So sometimes you just got to be cautious of what type of policy that you do have. And then when you do schedule your appointment, you're going to want to review with the staff which type of appointment that you prefer to have done. But with our Security Health Plan, Medicare Advantage plan, you do have coverage for the preventive exam. Must be done 11 months apart from the last one. So just be cautious of that, and at least have an idea of when the last one was scheduled to separate those out.
And I can just tail end on the end of that. I know most health systems, especially Marshfield, are very cognizant of which exam you've had, and there are stipulations and check boxes, just making sure to help out to make sure all of those appropriate exams are being scheduled for you as well. But that is an excellent question, and usually one of the most confusing.
Great. Another question that we received actually prior to today's webinar: can the annual wellness visit be combined with other visits? In other words, what if you have other new or ongoing issues that you want to see your doctor about? How will this be billed?
Well, I can start it out. I can't speak of the billing specifically, but the conversation, once it gets beyond the annual wellness parameters of things that can be talked to, they can be billed out separately, or the doctor will discuss with you a possible second office visit, depending on what that condition or concern is. Whether it's a skin lesion, those kinds of things, as an example, would have a separate visit you'd want to come back for, because these are really dedicated times to taking care of you individually. And then those other things would be worked out. And again, that's a separate type of billing issue and would come under a different umbrella from the annual wellness. But they can be done. It's just a matter of jockeying that into position and working within the parameters of your healthcare coverage.
Yeah, and I'd like to just tie in there too. And again, when you're making that appointment or scheduling your appointment, you're going to want to be clear with the provider. Tell them that you'd like to schedule both your annual wellness visit, and then possibly make it clear that you have some other issues that you'd like to discuss during that visit. Essentially, by providing this information to the person that's scheduling your appointment, they're going to know they're going to know exactly what to schedule you for, and then your provider will then bill that annual wellness visit, but they might tack on an office visit, which one nice benefit next year or this coming year with our Medicare Advantage plans is there's a $0 copay for our primary care office visits.
Which is going to be huge.
Mm-hmm.
Great. Another question that we just received. So if a physical exam is a covered benefit, would one have that in addition to an annual wellness visit, or would both be done within the same visit?
There are portions of a physical exam that are done within the same visit, but a complete physical exam would be more than likely a second visit, but really all ties into what your benefit plans are going to allow you to have and what is covered. Again, Security Health does a wonderful job with regards to that. And the reliance of the scheduling people, especially within the Marshfield system that I could speak of, are very good about separating those two types of appointments out and giving you an explanation, clarity of what you're coming in for.
Okay. If you set up your annual wellness visit, can you get a flu shot at the same time, or should you schedule the shot with your annual physical visit?
Through most health systems, and Marshfield specifically, yes, you can get a flu shot at any type of office visit that you're in here with. There's just a matter of making sure it's on the appropriate scheduling. But yes, the answer to the question is any visit you can get your flu shot at, as long as they have it in stock within regards to the specific clinic you're being seen by.
Mhm. Okay, another question we received. I've had just 3 annual wellness exams. At my 2020 wellness exam, my provider saw me virtual due to COVID. She told me she could not address any other issues or questions I had during the wellness exam, and I would have to make another appointment to address the other issues. Is this accurate? And if so, why?
Great question again. That's that gray area. There's certain parameters in which we need to work in with regards to the annual wellness. And if those questions were beyond that, where we had just alluded to earlier, there could be a second type of office type visit that needs to be built out because it's beyond the wellness parameters. And again, some of those resources we shared earlier would explain a lot of that, of what's going to be covered and what's not. The separate exam, it's again how your provider works it, because again, the scheduled time that we have to share with you for the annual wellness to go beyond that would cut into the schedule to take care of other things that wouldn't be covered under the wellness umbrella. If there are additional issues, again, a separate office visit may be needed, depending upon what the specific concerns were.
Yep, and I agree with that too, John. I mean, it really depends on the situation. It's likely, at least in this case, that there was just not enough time scheduled with the provider to address those other issues. So when we're scheduling these appointments, we do want to make it clear if we know ahead of time that there's going to be additional issues that you'd like to discuss with your doctor, that you'd like to schedule that annual wellness visit, but then also let them know that you'd like to review other issues with your provider. So the schedulers, I mean, it really helps them to know what to put on the books for the doctor.
Great. Another question we received, if I get an annual physical, why would I want a wellness visit too? Wouldn't that be redundant?
It depends upon your interpretation of redundancy, but the annual wellness is we're looking at a broad spectrum of all the basic needs and testings that you're entitled to, that you may not be aware of, that may not be come up in a physical exam. And again, what your coverage is, I know we keep going back to that, but the insurance dictates a lot of what able is to be done and what cannot be done. Medicare is very strict regarding the billing, so we can't bill for things that Medicare won't cover, because then we don't want any financial issues or burdens between you and your healthcare either. So that's why it's a very small parameter box that we have to stay within in both, whether it's a physical exam or annual wellness. But the capture of the information that's being shared through an annual wellness is a little greater than what would be done as a physical exam, or what is thought to be an annual physical exam.
And what about seeing a specialist? Do they need a new exam?
Referrals typically can be done as part of any exam that's being done. And if the physician has to step outside of the wellness parameters of that visit to touch on that, again, it's where the billing issues become a little cloudy, but your representatives through your insurance, especially Security Health, do an excellent job of being able to filter all that stuff out. But referrals to specialty can be done in or outside of that exam.
Okay. My healthcare provider always wants to code my annual as a wellness exam. I am thinking it's a physical because I have an Advantage plan, not Medicare. I'm thinking the frequency of the exam, once a year or once every 365 days. I'm thinking they're asking about
As far as coverage between the two. Yeah, with the physical exam, again, that with the Medicare Advantage plan, that is covered. Now, some Medicare plans, again, they don't cover that preventive exam. So you just got to be cautious of the type of policy that you have. But again, with our Advantage plans, physical exam, we do cover 11 months must be scheduled between each of those appointments. And then as John mentioned, a lot of times those schedulers, they're cognizant of when the last one you had. But then in addition to that, the wellness exam, that we do cover, that's based on a calendar year. So it could be done anytime in the year, and that's paid 100%.
Another question, if I chose a plan that I would be responsible for $10 for labs, is the annual exam going to cover all of the labs, or will I be responsible for $10 for each? Sometimes there are 15 or so lab tests.
Yeah, that's another great question. At least with our Advantage plan. So the copay is actually based on the order by the physician and not by the amount of the labs that are necessarily on that order. So if your primary care provider orders one set of labs with your x-ray, then you would just have one $10 copay.
Okay. I always receive an annual physical exam. When I turned 75, I could no longer get one, and no more PSA tests, no more DRE, and no more colonoscopy. It's like they're saying, you made it to 75, what more do you want? When I am done with my Medicare wellness exam, I feel like it was a waste of time. Maybe you can convince me to feel differently?
Sure, I'll try what I can on my end. No, you're not forgotten and you're not left off the side at 75. For sure, there are coverages. Medicare will pay for those kinds of things, like the PSA that was mentioned. That's an annual exam that's covered under the Medicare wellness umbrella. The colonoscopies, that's all going to be based on your specific history and related to your past results from the colonoscopies. There are certain parameters where you age out of things. That is true. But then again, it's your quality of life. These are kind of things that on that basis, if you've had your colorectal screenings and they've all been negative for a number of years, and your provider discusses with you the necessity and need for that exam, it may drop off your schedule, but there are things, and you are definitely not forgotten from the medical standpoint of it. And I know Security Health does a good job on that as far as following up of what is covered and what isn't as well through their statements and things. So you're not forgotten.
Yeah. I hear you, John. And then with those type of questions too, we always urge to bring up those questions and concerns with your primary care provider, especially with the colonoscopy. Yes, the American Cancer Society says, should have it through age 75, but people over that age, I mean, again, they still want to bring up those concerns with their healthcare provider. So they can assess the different type of risks of having those type of tests done after that specific age.
Great. Well, hopefully that the submitter was convinced. And I think we have time for just one more question. We have about 2 minutes left, but so my last question I'm going to ask today. So what is done at an annual physical exam if this individual has an Essence, I think it's HMO-POS plan?
That one I'll have to defer to Jason on.
As far as, let's take a look here. So we're wondering what exactly is done during the preventive exam versus what's done.
It looks like the annual physical exam. Is that one we might have to come back to?
That one we might have to come back.
Okay.
Yeah.
So the person who submitted that, we will follow up with an answer to that question.
That's really going to be individualized on their specific,
right.
their healthcare treatment plans that they're under and what their specific coverage is going to be.
Yes. And then, we had one of our colleagues bring up a great point, and Jason, this one is going to be for you. Where can we find this information so that we can keep it straight when we need to follow up with the doctor?
As far as our coverage information, can be found right in our evidence of coverage. You can go online, find that information if you have an online portal account. Always feel free to contact customer service. We're more than happy to answer any in-depth questions that you may have to go beyond just the general specifics here of the annual wellness preventive exam. We have dedicated staff to answer that. Otherwise, I think online is a great resource. We have customer guides. We have that evidence of coverage that can be mailed out to our members. Numerous resources that this information is referenced.
Great. Okay, well, with that, I just want to note before we depart that today, John's presentation today explained what happens during a Medicare annual wellness visit and how it differs from that annual physical. We also touched on how original Medicare covers these types of services. For Security Health Plan members, especially those with a Medicare Advantage plan, coverage may include additional preventive services beyond what original Medicare covers. If you need additional information about what we cover beyond what Medicare covers, feel free, as Jason shared, to call our customer service team at 1-877-998-0998. TTY 711 if you are hearing or speech impaired. We will share this information as well as the resources that John had highlighted in his presentation in our follow-up communication. So we will have all of this information to you in your fingertips with easy links to click before the end of this month, I do believe. So with that, I think we will go ahead and close. And until next time, next month, we'll see ya and stay well, everybody.
Stay well. Thank you all. Appreciate it.
Thank you.
Thanks.